Welcome everyone to this presentation on understanding pertussis. Over the next few slides, we'll delve into the intricate details of this infectious respiratory disease, exploring its causes, symptoms, treatment, and prevention strategies. I'm Vivek Gadvi, your presenter for today's session, and I'm excited to guide you through this exploration of pertussis. As we discussed, our health issue for today is pertussis. So what is pertussis? It's an acute inflammation of the larynx, trachea, and bronchi caused by Bordetella pertussis, characterized by recurrent bouts of spasmodic cough that continues until the breath is exhausted, then ends in a noisy inspiratory stridor, the whooping sound, caused by a laryngeal spasm. And this definition was derived from Stedman's Medical Dictionary. Pertussis is also known as whooping cough or as invented in China, this name, 100 days cough. A Bordetella pertussis is a fastidious gram-negative bacterium requiring special media for isolation. It produces multiple antigenic and biologically active products which are responsible for the clinical features of pertussis. This slide outlines the disease transmission process of pertussis, emphasizing its highly contagious nature through direct transmission via droplet spread. It explains how individuals infected with pertussis can spread the bacteria through coughing or sneezing even before symptoms appear, highlighting the importance of awareness and preventive measures when it comes to pertussis. Here we elaborate on the disease transmission process of pertussis, specifically focusing on indirect transmission through airborne means. It explains how Bordetella pertussis bacteria can remain suspended in the air, detailing the mechanism by which they attach to cilia and release toxins, which leads to inflammation and swelling of the airway. Now let's delve deeper into the intricate details of pertussis. First, incidence. In 2018 alone, the World Health Organization reported over 151,000 cases of pertussis globally. Within the United States, the Centers for Disease Control and Prevention documented 18,617 cases in 2019. The staggering numbers underscored the widespread prevalence and transmission of the disease. Talking about prevalence, pertussis is designated as a nationally notifiable disease in the United States, yet the actual prevalence may be underestimated due to underdiagnosis and underreporting. This highlights the need for enhanced surveillance and diagnostic efforts to accurately assess the true burden of pertussis. Morbidity and mortality data. Of particular concern is the impact of pertussis on infants, with approximately one-third of babies under the age of 1 requiring hospitalization due to whooping cough. Globally, pertussis contributes to significant morbidity and mortality, which estimates suggesting millions of cases and thousands of fatalities among children under 5 years old. These figures serve as a sobering reminder of the urgent need for effective prevention and control measures to combat the devastating effects of pertussis on vulnerable populations. Explore the signs, symptoms, incubation period, and treatment options for pertussis. Talking about signs, let's say early signs of pertussis can last for 1 to 2 weeks and typically include a runny or stuffed up nose, low-grade fever, mild occasional cough, and severe cases, apnea and cyanosis in baby and young children may be observed. Symptoms of pertussis typically develop 7 to 10 days after infection and initially resembles a common cold. They include a runny nose, nasal congestion, watery eyes, and low-grade fever. As the disease progresses, symptoms may escalate to include mucus accumulation in the throat, uncontrollable coughing fits, high-pitched intake of breath and coughing, vomiting due to severe coughing, and extreme fatigue. The incubation period of pertussis is usually 5 to 10 days, but symptoms may not manifest until up to 3 weeks of exposure. Pertussis is treated using antibiotics. Additionally, family members of the infected individuals may also be prescribed preventive antibiotics in order to reduce the risk of transmission in the case of pertussis. Focus on the population at risk for pertussis. Pertussis primarily affects children who are not vaccinated. It poses the greatest danger to infants and is a significant cause of disease and death in this age group. Infants under 12 months of age, particularly those who have not yet completed their vaccination schedule, are especially vulnerable to severe complications and death from pertussis. Pregnant women. For them, the women in their third trimester of pregnancy are also at increased risk for complications from pertussis. Pertussis infection during pregnancy can lead to serious consequences for both the mother and the unborn child, including preterm birth and low birth weight. Talking about the persons with pre-existing health conditions, such as immunocompromised individuals and those with moderate to severe asthma, may experience exacerbated symptoms and complications from pertussis infections. It is crucial for these individuals to take extra precautions to prevent pertussis and seek medical attention if they develop any kind of symptoms. Let's examine the demographics of pertussis. First one is age, and it is very important since pertussis incidence rates are highest in individuals aged 50 to 64 years. However, infants aged less than 1 year, who are at the greatest risk of serious disease and death, continue to have the highest reported rate of pertussis. When it comes to gender, the incidence rates are higher among women. And when it comes to race and ethnicity, higher rates of pertussis have been reported among some minority groups. Moving on to factors related to family history, genetics, mental health, and marital status. Let's say family history, there is no specific information available regarding the impact of family history on the incidence of pertussis. Genetics, there is no specific information available on the impact of genetics on the incidence of pertussis. Mental health and marital status, there is no direct correlation that was identified. Let's explore the social determinants that increase exposure or risk of pertussis. First one is lack of access to healthcare for vaccination. Let's say individuals lacking access to healthcare facilities for vaccination are at increased risk of pertussis. Living in crowded conditions can facilitate the spread of the disease. Patients with COPD or chronic obstructive pulmonary disease, or let's say asthma, have higher incidence rates and an increased risk of pertussis compared to the overall population. Talking about the socio-economic factors, an increase in pertussis incidence was observed with each 10 unit increase in the socio-economic index for the area. Let's explore the environmental factors that can influence the exposure or risk of pertussis. Temperature. A study conducted by Huang et al. In 2017 shed light on the impact of temperature on pertussis incidence. The research found that for each 1 degree Celsius increase in the monthly mean minimum temperature, there was an average decrease of 3.1% in monthly pertussis incidence. This finding highlights the intricate relationship between temperature and the transmission dynamics of pertussis. Warmer temperatures may potentially reduce the transmission of pertussis, although further research is needed to fully understand the underlying mechanisms. Examine the disparities related to pertussis. First we have is vaccination rates and access to healthcare. Let's say disparities in vaccination rates and access to healthcare can contribute to higher incidence rates of pertussis among marginalized communities. Socioeconomic factors such as poverty and inadequate housing can exacerbate the risk of pertussis transmission. Lack of awareness about the disease and its prevention can lead to higher incidence rates. Talking about the geographical location, let's say rural areas may have less access to healthcare facilities and vaccination, which leads to a higher risk of pertussis. Simultaneously, the urban areas with high population density can also see a faster spread of the disease. Let's discuss the additional epidemiologic variables related to pertussis. When it comes to screening tests, the CDC recommends laboratory tests for pertussis diagnosis, which are blood culture and PCR. Serologic testing may help to identify late-stage pertussis as well. When it comes to vaccines, there are two kinds of vaccines used in the United States today to help protect against whooping cough. First we have is diphtheria, tetanus, and pertussis, commonly known as DTaP vaccines, and tetanus, diphtheria, and pertussis vaccines, which are commonly known as Tdap vaccines. Let's summarize current hypotheses on pertussis. First we have is waning immunity, which comes from vaccination and natural infection, may also contribute to the resurgence of pertussis outbreaks. Underlying conditions, let's say adolescents and adults with underlying conditions such as asthma, COPD, or obesity are potentially at increased risk of pertussis infection. Similarly, immunodeficiency and smoking have also been associated with worsened pertussis symptoms and an increased pertussis-related hospitalization rate. Talking about the asymptomatic carriers, let's say quantitative research has proposed that asymptomatic carriers play a significant role in pertussis transmission, emphasizing the importance of identifying and treating carriers to control the outbreaks. Now let's delve into the gaps in knowledge on pertussis. At the forefront of our concerns is the need for comprehensive studies on a long-term effectiveness of pertussis vaccines. We must explore the duration of immunity conferred by vaccination and evaluate the necessity for booster strategies to maintain protection. Moreover, emerging evidence hints at the influence of genetic variations within the Bordetella Pertussis bacterium. Understanding these genetic nuances could significantly impact vaccine efficacy and disease severity. Yet, our grasp on the epidemiology of pertussis remains incomplete, especially concerning asymptomatic carriers and older age groups. These knowledge gaps underscore the urgency for continued research efforts to unravel the mysteries of pertussis and inform effective preventive measures. Now let's explore the actionable recommendations to advance pertussis prevention and control efforts. To begin with, we must intensify efforts to understand the burden of pertussis in vulnerable populations, such as adolescents and adults. This knowledge will guide us in devising targeted vaccination strategies and recommendations tailored to specific age groups. Expanding vaccination coverage and optimizing vaccination schedules are critical steps towards curbing pertussis transmission. Additionally, we must explore the development of new pertussis vaccines that offer enhanced protection and durability. A key intervention lies in vaccinating pregnant women during the third trimester, providing crucial immunity to newborns in their early months of life. And furthermore, implementing targeted public health interventions in high-risk community is paramount to reducing pertussis transmission rates. Now let's talk about the suggestions for further research on pertussis. Comprehensive studies are warranted to determine the true burden of pertussis in adolescent and adult populations. This includes elucidating the efficacy of current vaccination strategies and formulating evidence-based recommendations. Innovative research into new vaccine candidates holds promise for enhancing pertussis prevention. Exploring novel approaches that target additional Bordetella Pertussis antigens could revolutionize vaccine development. Moreover, a concerted effort is needed to establish an international framework for collaborative research and data sharing. These research endeavors are essential for informing evidence-based intervention and strengthening global pertussis control efforts. Let's shift our focus to the implementation of evidence-based interventions to combat pertussis. Strategies such as midwife delivery at antenatal care have shown remarkable success in boosting vaccine uptake rates. Automated electronic medical record reminders offer a cost-effective solution for improving immunization rates among at-risk populations. Enhancing provider awareness through targeted education campaigns is crucial for promoting vaccine acceptance and adherence. These evidence-based interventions have the potential to strengthen pertussis prevention efforts and reduce disease transmission rates. We have the reference slides. Thank you everyone for your time, and I hope you enjoyed my presentation. Thank you again.